Welcome to Aging with Freedom. This is our Thursday retirement news recap, and it is November 20th, 2020. Every week we try to highlight those things that really caught our attention that may affect your planning for or living of a successful proactive retirement. At Aging with Freedom, we focus on three large interrelated subjects. We call it our trifecta of a proactive, successful retirement. First is high health. That's our expenses, our income, and our assets that give us the freedom of how and where to live. This isn't an absolute number because how much we need depends upon how much we spend. But ideally, we need to have enough so that we have options about how and where to live. The second of the trifecta is high health. Health and wellness give us the physical ability to enjoy life, but they don't guarantee happiness. Plenty of wealthy and healthy people who are perfectly unhappy. Think of health as necessary. It's worth the investment of effort, but it's still not sufficient. And that leads us to our third and critical interrelated piece. That's high purpose. The purpose, the mission, or service to others is an essential element of happiness because this is the domain of wisdom, of perspective, gratitude, intellectual and emotional rewards. What follows is our weekly review of the news we found interesting in the trifecta of proactive aging to build a happy life. That's the news impacting the planning for and living out that successful third act of retirement. So, what we do every week is we assemble, watching the news, tracking different sources, a list, and we will share with you the links below in YouTube and on our website, agingwithfreedom.com. That'll let you follow up if you want more detail. But just a quick summary recap, see if you agree, share with us in the comments what you think, or if you have new leads for us to follow, would love that as well. We're going to start with an article from Builder on what we think is a kind of a nifty new label for trailing grandparents that move to where their adult children and their grandchildren are. We kind of like the label baby chasers, and Builder, which is the professional magazine of home builders across the country, has a really interesting article on some of the top markets where grandparents are chasing their millennial adult children in order to be able to spend time with their grandchildren. These include Charlotte, Austin, Nashville, and more here that we have experience with and enjoy. But we think that some of the things that they have in common mentioned in the article are these are cities that offer tech jobs and favorable climate or physical environment. Mountains aren't always warm, but they're fun. And these are factors attracting both millennials and their boomer parents. Furthermore, we think that this trend is only going to continue. More baby chasers as the pandemic is driving families to help each other and be together for mutual support. Next article we have up is, unfortunately, one of the other effects of the pandemic is that the pace of boomers retiring has accelerated in the past year, and accelerated rather dramatically. This is something that we warned about in April, right at the start, is that looking at past economic downturns, unfortunately, your timing of retirement is often not up to your plans, your boss, the economy, your health, all have a say. And COVID-19 upset boomers' workforce exit plan. Many of us planned to work until we were 70. That's going to be a lot harder to do, and it's showing up in the data. For instance, there's been a 2 million a year average of retirements for baby boomers since we started turning 65. Guess what? It's 3.2 million already this year. So that's almost a 50% jump because we're not even at the end of the year. And even worse, there was a big jump after February versus the usual January jump. There was about 250,000 in the period of February to September of 2019 after the usual end of year retirement in 2018. But for 2020, 1.1 million. That's a 4x increase in the number of retirement. Pew Research Center often has some really good statistical based research, and appreciate it. But be forewarned that we make plans, and sometimes the economy and life circumstances laugh, and we have to deal with the realities out there. One of our favorite pieces of advice from Teresa Gallarducci at the New School of Economics is to be prepared to retire before you plan to retire. And for most of us, that means being ready at 62, even if we plan to retire later. We just don't control the timing in many of the cases. About 60% of us end up retired not of the timing of our own choosing. And this article is offered not because we agree or think that it's going to happen or support it, but from the National Post there was an editorial on saving capitalism and taxing boomers in order to keep younger generations who are disaffected with capitalism happy. You can read that as kill capitalism to save capitalism. But in any case, the projections of your current retirement are based upon current law and circumstances. For instance, current tax law. One of the challenges of planning for retirement is the unknown. Things could change. Law could change. Tax rules could change drastically. And at some point, you just have to be willing to say, you can't protect or predict everything. You just have to accept the fact that if some things change, we're just going to have to figure out a way to get by. This may fall into that category. But it does highlight, we think that there is increasing political risk of discontinuous change in American politics that make it harder to predict what will happen with our assets and our income going forward. But you got to just keep that in mind. One of the things that we're doing to ensure or protect against the future is, we're in our early 60s or late 50s and semi-retired, self-employed, so we're insured not through an employer, but through the Affordable Care Act's Marketplace Exchange. And we are consciously choosing HSA or Health Savings Account matched insurance plans so that we have the advantage of accumulating some savings for future healthcare expenses. And Fidelity has a really nice summary of HSAs and how they can be used, and we think they're particularly appropriate for those of us in semi-retirement or self-employment before we're eligible for Medicare at age 65. Here's a quick summary from Fidelity, but the critical thing is that the HSAs are really the only thing that we can recall that are triple tax advantaged. The money that you put in is tax-free, not subject to income tax. The income that accumulates from interest or increase in value within the account accumulates tax-free. And unlike your traditional 401k or IRA, even when you take money out to use it for qualified health care or long-term care expenses, the money comes out tax-free. So that's a triple tax-free deal that we think is a really powerful planning tool to manage healthcare expenses as we age through retirement. And there are several ways that helps. It's a bridge to Medicare. That's exactly what we're using it as. Once you're in Medicare, you can use the money that you've accumulated there to pay Medicare premiums. And you can pay out any long-term care expenses. And for that matter, you can pay your everyday prescription expenses and those sorts of things from your HSA account. Right now, we're eligible to put in, under current rules, $8,100 a year. That includes $1,000 of catch-up contributions, as so-called, if you're over age 55. If you're under age 55, the maximum annual amount currently that you can contribute is $7,100 a year. Why is that useful? Well, for most of the policies now in reformed healthcare, deductibles are a lot more expensive than they used to be. A lot of us are looking at $10,000 or more deductibles. One of the big advantages here is, you get a few years of savings in your HSA, and that deductible no longer looks like a hassle. Why do we use the insurance through the Affordable Care Act exchange? Is that it also offers tax credit subsidies based upon income. If your modified adjusted gross income is less than about $65,000 a year, it changes every year about 4 times the poverty level, there are tax credits that make the insurance premiums more affordable. There's also problems with that if your income is above that, because it's a cliff. You go from as much as paying nothing for a premium to paying the full cost of an insurance premium under the Affordable Care Act, which for a couple can be north of $20,000 a year. So but if you have the right income, that tax credit is a really big help. Additionally, one of our favorite YouTubers and financial planners that we follow, Heritage Wealth Planning, Josh Scandlen, has a really great article on how to use HSAs as your backup plan rather than long-term care insurance for Alzheimer's or dementia, with a really great example of, if you save from basically 50 through 65 when you become Medicare eligible and invest that, don't use it, have a reasonable rate of return of about 7%, that you can have a substantial savings pool for your expenses in healthcare in retirement, including long-term care, of north of $500,000. Really slick financial planning advice for those of you who are familiar with HSAs. If you're not, again, take a look at Fidelity, take a look at Josh Scandlen's discussion on Heritage Wealth Planning. We think you'll enjoy it. Okay, on to high health. Remember, high health is the priority of extending wellness to enjoy life. It's necessary, but not sufficient for happiness. And we typically look at 3 or 4 things in this. We look at the science, we look at new products and services, and we look at some of the personal choices that we have to make with regards to our health and wellness. And just wanted, in the environment of the pandemic and COVID, one of the long-term side effects that has come up frequently for many people, including those who did not have necessarily severe symptoms during their initial infection, is there are some follow-on complications that are occurring, including confusion or poor memory, and it's described as brain fog. Wired has a really good article about brain fog, and its tie to COVID. Interestingly, this is not an exclusive symptom. It's a frequent problem for people who have been in an intensive care unit, and you may have seen issues with delirium with folks or relatives that have been in the hospital and have either been on a ventilator or have had general anesthesia. So, is this the effect of the illness or is it effect of the treatment? Some of these questions, are still being sorted out. But be aware that the initial risks of early death or difficulty breathing aren't the only problems with COVID. And this brain fog issue is something that comes up even for people who were never hospitalized with COVID. So just be aware that it's not just the one time get through it. We'll have some ongoing issues, particularly the long haulers, so-called long haulers. So that's one to pay attention to. We often talk about exercise as an important thing. We saw an article recently of the popularity of e-bikes or electric bikes, and the research from Europe is that people actually get as much exercise value from the electric assisted bikes as from the non-electric assisted bikes. How could that be? Well, people ride farther with the electric bikes than they otherwise would with the pure pedal powered one. And we kind of like business a little bit too. So Harley Davidson Serial 1 has announced the pricing for the Harley Davidson designed e-bicycles. They're extending their market beyond just motorcycles and cruisers to include e-bikes, maybe following their boomer clients further into retirement. We kind of like the looks of and the thought of the e-bikes from Harley. It's one that we're thinking about and looking forward to. They have various models of different battery capacity and top speed. There's the 20 mile an hour top speed one and the 28 mile per hour top speed one. But these are pedal assist types of e-bikes that still keep you doing some of the work and getting that exercise as well. So take a look at the Harley Davidson Serial 1. We think that's a fun one coming up. Another product that is emerging is, get back to this, Alexa from Amazon has added a new feature called the Alexa Care Hub. And the Alexa Care Hub is basically a function or tool that will help family members keep track of and monitor their family members, particularly their older family members. And we've gone through the experience of family caregiving for elderly folks and wanting to make sure that they're okay and connecting, communicating with them, monitoring whether they've taken their medicine. All of these are things that the Alexa Care Hub facilitates. We use Alexa, and it's kind of the advent of the voice-activated personal assistant. It has a lot of benefits in our personal life. This extends that to helping keep track of another family member and maintaining connection and how they are doing. So we think that that's really fun too. On to high purpose. High purpose, as remember, is answers the why to live question. We always need an answer to that. That we need a reason to get up in the morning. The Japanese call it ikigai. That's the finding the meaning and the happiness in life. And it turns out we found this article that appealed to us because Lori, my co-author, partner, and spouse, is a landscape architect by original training. And guess what? Gardening could be the hobby that helps you live to 100. This is from the BBC, but there's some statistical evidence and evidence from the so-called blue zones of where people live the longest that connections with nature, being out in the garden, those are things that actually improve both our health and our well-being. We have an extended article on the value of green aging, on aging with freedom. Just living with nature is an important part of our happiness as we age. We think it gives perspective, but if nothing else, statistically, guess what? You're better for it, you'll live longer, you'll live healthier, and you'll be happier. So get out in the natural world, plan that garden for next spring, or if you live where you can garden year-round, go for it, enjoy it. Another one that we saw that applies to that health and wellness is a cautionary tale, is that our moods spill over onto our spouses. This is from the University of Michigan News, but summarizes some research that was done by the University of Michigan in conjunction with a Chinese university. So it's cross-cultural. It's not just limited to American background. But it turns out that how we live and behave with our spouse matters. Age isn't just how others perceive us, but our perception of age spills over on those around us. That goes back to the importance of purpose and the wellspring of a positive outlook, looking for that reason to live, maintaining some optimism. Finally, we really pay attention to kind of the futurist or the prognostications of what's coming, because this affects what we may need to do in the future. The Wall Street Journal has a really interesting article on how COVID-19 will change aging and retirement. We agree with a lot of it. More people are going to age at home. The group living environments look scarier because that's where all of the problems have been concentrated when it comes to death and illness. Very high percentage of the morbidity or early deaths have happened in senior housing or nursing homes. That means, people have even more reasons to stay in the familiar and age in place. We think that the Wall Street Journal is right, that future big social gatherings, we may develop the habit. We kind of like these smaller social connections from COVID. It may take us a while to get comfortable with big crowds again. So smaller, more social settings are going to be better, maybe not just in 2020, but going forward for many years. So your close friends may be particularly important for those small group settings. They also see the impending impact of a technology boom on technology of aging, particularly around wearables and remote health like telemedicine. Clearly telemedicine is boomed during the COVID age. That's only going to continue. Kind of the bad news that the Wall Street Journal sees is shorter lifespans. Not just average, because we've lost some people to early death because of COVID, but some of the long-term effects of COVID are going to reduce even those of us who survive expected life expectancy. But the good news is that kind of our interdependency of family relationships across generations and friends are more valued, and hopefully that will continue past the pandemic as well. And finally, we have one last piece of our own prediction for the future. And this is based partly upon an article from the Deacon Herald of how many doctors are calling it quits under the stress of the pandemic. Too much stress, and then not enough work or revenue. It's kind of ironic that a lot of doctors have had their their practices disrupted, because if they're not in pulmonary care, if they're not in ER, if they're not hospitalists, say you're a dermatologist, guess what? A lot of your patients aren't coming into the office. They don't want to risk infection. And you're sitting there with a huge drop of revenue, significant overhead. Okay, time to retire and call it quits if I'm close to the margin. There's even doctors choosing to do just something entirely else. They have their own health concerns, especially on the eve of retirement. It's kind of hard to work an entire life and then not have that opportunity for at least some family time. The family of a physician has to live with long hours and unpredictable calls and those sorts of things. So retirement often beckons as, here's my payback for my time with family. And there's even, post-traumatic stress syndrome issues with all of the challenges in healthcare, particularly in a COVID environment. This is just a reminder to us that we're going to have fewer doctors going forward. If there was a mistake in the Affordable Care Act, is it expanded the number of people in the system, but it didn't expand the number of physicians in the system. So we're going to have worse primary care access, even more so after COVID, especially in rural areas. A lot of challenges around rural hospitals going broke as the result of COVID. So what's that mean going forward is we're going to have to replace physicians, and that probably means more technology for non-clinical, that is not in the hospital or not in the doctor's office, health monitoring. That's those wearables like your Fitbit or your Apple Watch and other tools. And we're going to use artificial intelligence-based diagnosis using machine learning computers to detect subtle changes and trends in our health, even before symptoms emerge that otherwise might allow, your human doctor to do the diagnosis. So, this can result in some really good outcomes in healthcare. We may get more and better and accurate and earlier diagnosis for more effective intervention. And we're going to spend less on that diagnosis than we do today. So that's our big prediction. As a result of fewer doctors, it's going to be more technology, especially more non-clinical monitoring in order to do early diagnosis and intervention. And we think that may actually create a system that saves money on diagnosis and is more effective because of early intervention. That's our summary for the week of November 20th, 2020. We hope that you have a great week ahead. We look forward to your comments below. Be sure to check out the links for more detail and stay safe and work on your trifecta of high wealth, high health, and high purpose for that successful and purposeful third act of retirement. Have a great week.